As you heard, South Africa's decision to impose a hard lockdown has been criticized by opposition parties and some sections of society. Many are arguing that it's likely to cause far greater suffering in the short and long term than the pandemic itself. But how does South Africa compare with other countries in terms of its response to the pandemic? We're joined by David Clement. He is the North American Affairs Manager for the Consumer Choice Center. David, good evening, and thanks for your time on News at Prime. Consumer choice is quite important, but in the days of COVID-19 and in a country like South Africa, it is precisely consumer choice that has been limited. Speak to us about how different the approach of the South African government has been to perhaps what you've seen in your country in Canada.
So obviously, South Africa enacted what I would consider to be a very heavy-handed ban on certain products. And if we contrast that with what Canada has done, the responses are quite different. Generally speaking, the Canadian government and the provincial governments have tried to make life as normal as possible by expanding consumer choice throughout the pandemic. And so what I mean by that is they declared alcohol outlets to be essential businesses. They expanded their hours of sale. They allowed for restaurants to deliver alcohol with food, which was previously prohibited. They deemed convenience stores, which is where tobacco and vaping products are sold, to be essential outlets. And they even went so far as to declare cannabis outlets. Now, cannabis is legal in Canada. They declared cannabis outlets to be essential and allowed for them to offer click and collect, curbside pickup, and delivery options. And so it is a very stark contrast between the two approaches for the two countries. And well, what I think is important is that Canada was actually and has actually been hit much harder by COVID-19 in comparison when you look at both the total number of infections as well as the amount per capita.
I wanted to bring in here, in terms of the comparison, when you look at a country like South Africa that is facing its own societal issues and its own problems in terms of the public health system and how that compares against Canada, are we really comparing apples with apples here?
Well, I think that that is a fair critique. There are certainly differences between the healthcare systems. It would be naive to not recognize that. But what I would point out is that when we prohibit a product, especially a product that is otherwise legal, it doesn't mean that consumers aren't going to access it. It almost always means that consumers are going to access it in the legal market. And that obviously is a net negative for society because people are buying these products from criminal actors, and it emboldens and provides profits for those folks. But more importantly, from the public health side of this, is it pushes consumers to riskier versions of legal products that are available in the illegal and unregulated market. We saw that with alcohol, with a few instances in South Africa where people unfortunately passed away as a result of drinking tainted products. And so I think it's fair to note that the healthcare systems are different, but I would argue that legislators in South Africa are maybe naive to assume that a ban works and are short-sighted in thinking that a ban means that consumers will stop consuming these products.
One of the things that you're also pointing to, I think, is really an issue around principle and attitude and this paternalistic attitude of the state in terms of how far it can go in directly intervening in people's lives.
Yeah, I think that this is an important point for South Africans to ask themselves. Is it appropriate for the government to use a pandemic to ban products that are otherwise legal? I would argue that it isn't. Many of the people whom I've spoken to have said the same and echoed those same complaints and feel that the government is inappropriately using this pandemic to drive home other public health initiatives. And I think we can certainly have a conversation about those products and the risks that they assume. But I do think that there is increasing agreement among consumers that it is inappropriate to reenact prohibition and it's naive to think that prohibition will somehow work this time around.
Why is consumer choice important? What does it do for a country's economy?
So consumer choice is important because competition is the lifeblood of economic activity and prosperity. When consumers have the ability to choose between different products or different businesses that they want to do, that they want to engage with and have commerce with, it fuels that industrial capacity that is in us to make society more prosperous, to generate wealth in ways that haven't been possible before, to tap into the creativity of your fellow humans and to engage in that commerce and that open commerce. And so we very much focus on consumer choice from that perspective because it comes with so many benefits, not only to the people who are consuming those products per se, but also the ones who are providing them, the small businesses who, let's say, sell beer or wine or any other product for that matter. It's very important that I would argue that South Africa should follow Canada's lead in embracing consumer choice in a pandemic rather than limiting it.
You've talked about the numbers and how different what we're seeing in Canada has been to South Africa, a much higher rate of infection. And, you know, the South African government has always said that it's moving from the point of saving lives. And surely, comparatively, when we look at the numbers, it means that they've done a better job at it, or not?
Well, I think that what we have to not confuse is limiting behaviors that spread the risk of COVID-19 and limiting behaviors that do not. So we can argue the effectiveness of lockdowns, and I certainly think that there is growing evidence that they do work in some instances because they prevent us from being in close quarters with other people, which is where we know transmission for the virus comes from. That being said, there is no link between consuming alcohol and getting COVID-19. Being able to purchase a legal product at a store does not increase your risk of contracting COVID-19 in any serious way when we compare it to the other things that we've rightfully limited citizens from being able to do. And so it is certainly reasonable to enact various measures to try and limit exposure, but I would argue that it is not appropriate to recreate prohibition in the process and completely prohibit otherwise legal products that consumers want to consume.
All right. David Clement, let's leave it there for tonight. Thanks for your time on News at Prime. He is